We are still dealing with the virus's Delta variant and surging cases in crowded hospitals.
But people are still turning out for large public events like fall football and festivals. Mecklenburg County Health Director Gibbie joins us this morning to discuss all things COVID and hopefully how to stop it. Good morning. Thanks for joining us again.
Good morning. Thank you for having me here.
So we just had a really successful weekend of crowds, hundreds of thousands of folks swimming all around the Queen City with football. We've got festivals and races going on, which is good news for some. We feel like we're getting back to our daily life, but the numbers continue to be going up. What worries you about moving into fall?
There are a number of challenges that we have going on right now. Unfortunately, we're in a different situation this fall than we were last fall. We are seeing higher numbers than we did last fall. Our percent positivity rate is higher this year than it was last fall. Last fall, we were at 5 to 6%. Now we're looking at 13%. Our hospitals have 2/3 more individuals with COVID in hospitals than we did. Our kids are back in school. And as you can see from these crowds, people are getting back to behavior pre-COVID. And then we have the Delta variant, which is incredibly transmissible. So when you put all of those things together, there is no possibility that COVID is not in those crowds, none at all. And we know how transmissible this particular variant is. So we anticipate our numbers going up over the next couple of weeks based on what we saw this weekend, based on the fact that our children are back in school, and just the fact that people aren't wearing masks and our vaccination rates aren't what we need them to be.
And Gibbie, we know that the hospitals are already stressed and strained, and they're seeing more patients with COVID. When you think about the timeline of Labor Day and the events, what is that going to look like for the hospitals come, 10 days from now?
So hospitalizations is what we call a lagging indicator. It takes a couple of weeks, usually, after a spike in cases for us to see the spike in hospitalizations. And as I said, our hospitals are already at a higher rate than they were last year, this time with the number of COVID cases. So in the next week or two, we anticipate seeing more cases in our hospitals. The majority of those, greater than 90% of them, are people who have not been vaccinated. We're seeing cases go up. We anticipate that because of this particular variant, and because people are more active. But what we know is if they've been vaccinated, the likelihood that they're going to have to take up space in a hospital, possibly be on a ventilator, and even potentially die from this virus goes way down if they get that vaccination. So we really need to encourage people to do that. And then when they're out in crowds like that, they should be wearing a mask. That's the second best thing that they can do.
We've been hearing, we've already had a couple stories this morning about a new variant that is starting to creep up, and maybe it's been around a while. I believe it's called the Mu variant. What is this? Should we be concerned with it? Is it so rare that it's not really something to think about?
It is a variant of concern right now, one that they're watching. We have not, as far as we know, seen it in our community in North Carolina at this point. But any new variant is something that we've got to watch carefully. When Delta came along, we had no idea how significant that was going to be. This particular variant seems to be causing problems in other parts of the world. So again, needing to keep a very close eye on it. And our concern is eventually one of these variants is really going to give our vaccines a run for their money. And our vaccines are not going to be as effective as they seem to be right now. So again, the way to stop these variants from popping up is to have more people vaccinated. So again, I know I sound like a broken record, but that's what we need to do. People need to get vaccinated, and they need to wear a mask right now.
Gibbie, you just said you feel like a broken record. How are you and your team kind of navigating all this? Because it seems like COVID is not something that is really, it's going to be a part of our lives moving forward. And it's how do we get it to where we can manage it and still go and do all the things that we all love to do and so many people have missed for 20 months now?
You're right. There's already conversation about the fact that we are moving from pandemic into an endemic situation, which really means that this virus is here to stay. It's like the flu. It's not going anywhere. The challenge we have right now is it has a higher rate of mortality. It has a higher rate of severe illness, and it's more transmissible even than the flu. So right now we know that we've still got a challenge on our hands to get this under control. But if we want to get it under control, if we want to get it to the place where we can manage it and we can do the things that we want to do without being concerned every time we walk out the door that we may be infected, we need more people vaccinated. And for the time being, not forever, but for the time being, we need people to wear a mask. And if you are ill, if you have any kind of unexplained illness, whether it's a head cold, a sore throat, a cough, just feeling bad, don't go out. Don't expose others in our community until you're feeling better. And if you think there's any chance that it could be COVID, get tested. Those are the things that people need to be considering right now. Obviously, based on what we saw this weekend, telling people to stay home and out of crowds isn't working. People are wanting to be back out. It's football season. They're really interested in doing what they've done in the past. I understand all of that, but the way to manage that is vaccinations and making sure that you're wearing a mask when you're in a crowd like that.
Gibbie Harris, Mecklenburg County Health Director, thank you for your time as always and your efforts behind the screen and everyone else that works with the county on trying to keep us healthy. Thank you for your time.
Thank you. Y'all have a great day.
You too.